The first thing is that the meeting has been kept at a hotel which is very centrally located. It's at the Aero City, which is very close to the airport. So all international and national delegates, it will be very smooth and streamlined for them to travel from the airport to the hotel, which should take less than 5 minutes. Otherwise, the Delhi traffic, it can be terrible for people. So I think that's a very important thing, that there is no hassle in traveling from airport to the venue. The second thing is that the Aero City can accommodate more than 3,000 delegates. So we are hoping that most of the people will be able to stay at the Aero City, and that will be very convenient for them. And they can just, even if they are staying at any other hotel, they can just walk to the venue. And for their convenience, we have organized pollution-free CNG shuttles for them to travel from their hotel to the venue, but it should be a 5-minute walk as well. We have a plethora of faculty coming from abroad, from various countries like the United States, Europe, France, United Kingdom, Japan, and some of the neighboring countries as well. So we have Professor Lee Kaplan, who is Professor of Gastroenterology and Metabolic Diseases at Harvard University, Boston, USA. Now, treating diabetes and obesity and metabolic disorders has never been the forte of a gastroenterologist. But new research has shown that even gastroenterologists can do interventions which can help in treating diabetes and metabolic disorders. So we have one of the most prominent people in the international fraternity, Dr. Lee Kaplan, who will be teaching us on this aspect. We have other faculty, Professor Zubair Younossi. He's a leading authority on non-alcoholic fatty liver disease. We have Professor Ravi Mittal. He's a leading expert on gastroesophageal reflux disease and irritable bowel syndrome. These are very common. I think almost every second person suffers from reflux. So with his experience and research, we hope to get new insights on how we can manage these issues better. We have kept a session for the first time ever in ISGCON, which is called Coffee with the Experts. And so these are informal small group discussions, and we hope that the young gastroenterologists can interact with very senior and experienced gastroenterologists from across the world, and they can really ask questions which they have, which sometimes you cannot ask in bigger meetings. If 1,000 people are sitting, sometimes you are apprehensive of asking questions. So we hope that with these small group discussions, they can clarify doubts, and they can, take home a very clear message from our international experts. Another thing which we have done is we have kept a special interest group symposia. Again, if a young gastroenterologist is interested in a very specific area, for example, pancreatitis, so we have a host of faculty which will be speaking on the pancreatitis, and these are again small group discussions. So we've tried to cater to the needs of younger gastroenterologists, and so that they can take home a clear-cut message from these experts. Apart from the scientific content, the meeting gives these young gastroenterologists a chance to interact with them, and maybe even plan for their future, or do a fellowship abroad, or plan research projects with them in collaboration. So I think that's another very important aspect. The conference is going to run for almost 4 days, and we will be having 3 parallel halls running. So we have actually almost 11 to 12 days worth of scientific meeting, and we have very carefully chosen all the topics so as to justify the lectures which are being given by the international faculty. We have tried to cover all aspects of gastroenterology, like luminal gastroenterology, pancreatobiliary gastroenterology, endoscopy, liver diseases, so inflammatory bowel diseases. So the scientific content will make sure that all topics of gastroenterology are covered, and interests of all gastroenterologists are met.